You're listening to the Holistic Nootropics Podcast, your home for holistic, evidence-based cognitive enhancement strategies. And now your host, Eric Levi.
Hey, what is going on, everybody? Welcome back to the Holistic Nootropics Podcast, where we talk about using nootropics, biohacking, and nutrition to help you boost your cognition. On the podcast today, we have Dr. Alan Bauman. Dr. Alan Bauman is a full-time board-certified hair restoration physician who has treated over 30,000 patients, has performed over 10,000 hair transplant procedures, and over 8,000 PRPs since starting his medical practice or his medical hair loss practice, Bauman Medical, in 1997. Dr. Bauman is known for pioneering numerous technologies in the field of hair restoration and has been cited as the #1 top hair restoration surgeon in North America by Aesthetic Everything, the top hair restoration surgeon of the decade. And he was recently named by Forbes as one of the 10 CEOs or top 10 CEOs transforming healthcare in America, which is, all that is so awesome. And I'm going to bring Dr. Bauman in here in just a second to talk all about his take on health and wellness and how we could possibly grow our hair back. But first, just want to give a quick shout out to the Biohacking Congress, where Dr. Alan Bauman will be one of the featured speakers, along with many other top voices in the health, wellness, and biohacking community. If you are interested in going to the Biohacking Congress, it's October 16th and 17th in Miami, Florida. This is really the first major health conference happening in almost 2 years. And so if you're chomping at the bit to be around like-minded folks who want to talk about health, wellness, longevity, all that good stuff, then you're going to want to go to the Biohacking Congress. And the best part is you can get 50% off of your ticket to the conference by going to biohackingcongress.com and using the code word HACK50 at checkout. Again, that's HACK50 at checkout. But let's say maybe you don't want to travel, you don't want to get on a plane, you don't want to wear a mask on a plane. I totally get it. Or maybe you don't want to travel, be in person, maybe you got time constraints, whatever it is. You can actually watch the Biohacking Congress virtually from the comfort of your own home. And the best part is I have some free tickets to give to you, the Holistic Nootropics listener or viewer. If you want one of those free tickets, all you got to do is head on over to Apple Podcasts, leave the Holistic Nootropics Podcast a 5-star review, take a screenshot of that, email it to me over at info@holisticnootropics.com, and I will go ahead and send you a free ticket. This is the deal of a lifetime, folks. Don't pass it up. And with no further ado, Dr. Bauman, welcome to the Holistic Nootropics Podcast.
Thanks, Eric. Great to be with you today.
Absolutely. I'm so pumped for this podcast. Like, I do a lot of podcasts with doctors and researchers, scientists, entrepreneurs. And we talk about health, we talk about wellness, we talk about nutrition, and we talk about, hey, this thing will help you live longer. This thing will help you feel better. But for me, and I'm sure a lot of other people in my position, sometimes it just comes all down to how you look. And I know for me, hair was always a big thing. Being a Jew who comes from a long line of bald male Jews, it was inevitable. I knew it was going to happen. And I've done my best to fight the sands of time in losing my hair or keeping what I got left. But this seems to be something that you've taken and you've run with and you're transforming lives. And I totally understand the profound impact you could be making on a man's life or a woman's life by doing this. So I would love to know your origin story. How did you get into this? How did you get into this specific field? And what have you done that has made you, so well renowned as one of the top surgeons in this field?
Well, let me tell you, Eric, it's been an amazing journey. And I guess it all started without me realizing it, watching my dad go bald when I was a teenager. And so watching him lose his hair, kind of struggle with it, doing the comb overs, doing some prescribed lotions, and eventually, unfortunately, getting into a hairpiece made me think about my own hair. I love my hair. I grew it long when I was in college and in medical school. But as you did, you came from a long line of guys maybe who didn't have much hair. And my dad's dad, I never met the guy with hair. And like I said, my dad went bald when I was a teenager, and my mom's dad had some severe hair loss. So I just figured it was coming my way, and I didn't really know anything about what to do about it, honestly, until much later on in life. And so I was in medical school. I was being mentored by a plastic surgeon. I figured that was the direction I was going to take. And around the time I was in my internship and residency program in Manhattan doing general surgery, always thinking plastic surgery was going to be my thing, I met a patient who had had a hair transplant, and not by anybody that we knew. And it was just coincidence that he kind of revealed it to me. I looked at him. It didn't look like a hair transplant to me. And so I was kind of intrigued about it. And we got into this conversation. And I learned two things that day that really changed my life. Number one was that a hair transplant could be completely undetectable. Certainly fooled me. And the other thing that stuck with me was how this gentleman explained that the hair regrowth and the hair restoration totally changed his life, both professionally and socially. So I kind of tucked that back in my brain. And as I had a chance to go through some plastic surgery conferences and cosmetic conferences, I always kind of kept an eye out for hair transplant stuff. And I just learned about it more and more and more. And eventually I found my second mentor, who is a very busy hair transplant surgeon in New York. And we connected just by phone, actually. And he invited me into the practice. And eventually I became trained and did a fellowship with him for over a year. And I never looked back after that. I always thought, well, maybe hair transplant would be something I would do within my plastic surgery practice. But after doing hair transplant procedures for about a year or so, I just knew that I wanted to dive in 100%. And so that's really where I got started. And then I met my wife around that same time. We moved to Boca Raton, Florida, and I started my hair transplant practice with a tiny 1,000 square foot facility with one operatory and zero staff and zero referrals, and just kind of had to build the practice door to door, patient by patient, one at a time, and trying to get good results all the way through from day one. And it's been an exciting journey. 25 years later, here we are. Got the 12,000 square foot hair hospital in Boca Raton, Florida. And you mentioned the numbers of patients that we've treated. And, over 1,000 to 1,500 patients come through the door every year seeking the kind of work that we do. And I feel like I've contributed a lot to the industry, and just hearing those patients after they have their hair restored, men, women, even children with birth defects and things like that. And the veterans that we do pro bono who have been injured and so forth. It's just amazing to hear their stories. And that's what gives us the joy and the benefit each and every day of doing the work that we do. And hair, when you restore it, it's like that magic light switch just turns on the happiness, So it's a fun practice to have. And I feel very, very blessed. And I have an amazing team of nearly 30 practitioners now and admin folk and clinical team members who help me get the job done every single day with exceptional care and passion. So it's been a super fun ride. That's amazing.
A 12,000 foot hair hospital. I mean, it's like a super center of hair regrowth. And I think you nailed it, because like as a guy, when you have that inkling, you're like, I'm definitely going bald. And you do everything you can to fight it. You don't know, and you see all the products out there and you just kind of know it's coming. And then like for me, I was 19 and the hair, it was like I was in the shower and it was like, oh, it's starting now. And throughout my 20s, it progressed. And it was just always one of those things, like not actively looking, but just kind of like, is there something out there? Because this feels so inevitable. And I would imagine that for a lot of men, especially single guys, especially maybe even older guys who are single and, don't want that age to creep up on them like that. It's gotta be life transforming.
Oh, yeah. Well, just like that first guy I met, the hair made him look good and feel good on the inside. And we can get into how the hair follicle, very, very highly metabolic cell population in the body that kind of exudes your health and youth and vitality, and obviously evolutionarily plays a big role in attracting a mate, whether you're a man or a woman. Typically, a good, healthy head of hair says something about how you live and your genetics and so forth. And so if you're losing your hair, like you just said, it can be a struggle. You don't know what to do, where to turn. And that's one of the things I've tried to change in the industry, is really push out a lot of information and a lot of content for those people who are suffering out there or don't want to suffer with their hair loss situation, don't want to accept it, don't want to shave it, don't want to buzz cut it, don't want to wear a wig, weave, or whatever. And they want to keep their existing hair or grow their hair back. There's a lot of really effective ways to do that today. And that's, like I said, that's the fun part.
So what is in general the cause of hair loss?
So what you inherit in male and female pattern hair loss is a sensitivity of those hair follicles. So in male androgenetic alopecia or male pattern hair loss, what you've inherited is a sensitivity to dihydrotestosterone. That's the primary trigger for male pattern hair loss. So it doesn't mean that you have like all this testosterone or some huge high level of DHT, the dihydrotestosterone metabolite of testosterone, but it just means that your follicles are sensitive to it. So you're going to start to see some weakening of the hairline, some miniaturization. It's going to start to recede. You could start to see more shedding. You could start to see more scalp shining through. And so it happens in a very recognizable pattern. See that recession of the hairline, the bald spot developing in the crown. Now, for women, it's a little bit different. Typically, they see a more diffuse pattern, although it can also recede the hairline a little bit. They don't typically go bald like men do. But the good news is that there's a lot you can do about it. And so that hormone is the main trigger, but there's other things too. Your vitality and your health level, your nutrition, your stress level, your sleep-wake cycles, inflammation in the body, medications that you might be taking, and other factors can certainly influence hair growth in a detrimental or positive way. So you want to, we take a very holistic approach all the way down to the health of the scalp. I mean, I have an entire department dedicated to keep your scalp healthy so that we can grow good hair.
Wow. So the testosterone thing is interesting because you're the first person I've heard, at least that I've talked to. And there is this thing, about like, hey, you don't want too much testosterone because that's what makes your hair fall out. Like you want testosterone, but you don't want too much. And what you just said is it has nothing to do with how much testosterone, but the specific metabolite of testosterone, dihydrotestosterone, I believe. Where does that metabolite come from? And is there something in your lifestyle or diet or, whatever it is, sunshine, whatever it is that you can do to minimize that?
Well, unfortunately, there's really the main medication for blocking the formation of DHT. DHT is formed from testosterone by 5-alpha reductase, which is an enzyme in your body. And over time, as your testosterone lowers, you'll have a slower bit of hair loss going on because it's less metabolites maybe being formed. But in general, if you're sensitive to DHT, you're going to continue to thin out over time. So what can we do about that? Very often finasteride is used. That's a prescription FDA-approved oral medication to block the type 2 5-alpha reductase enzyme, which is the main pathway towards DHT. And if you go on that medication, it's a very powerful medication, by the way. 90% of guys look the same or better in the long run. So that's a very good news. That's your benefit, right? And about 2% of patients, unfortunately, will have sexual side effects from the drug. So decreased libido, mild erectile dysfunction, even decreased ejaculate volume can occur. But the good news is that these are temporary and mild. Stop the medication. The medication's out of your body in a week, and you should be back to normal. So finasteride is one of the first lines of approach, but certainly not the only thing that we do. There's another pharmaceutical, minoxidil, but there's a lot of other things that we can do to try to make the follicles more resilient and grow better, thicker, stronger, healthier hair over time without the use of medications. And that's been an exciting part of the field of hair restoration, that these, it's not just minoxidil topicals or finasteride oral treatments anymore, but we have other things now too, like regenerative medicine, phototherapy, nutritional supplementation, the proper hair care, nutrition, those types of things.
Yeah, and I want to get into all that stuff, but I do want to actually come back to finasteride because I've used finasteride. I used it for a couple of years, I think like 2 or 3 years, and it didn't have much of an effect for me. I don't know if I took it right. I used the ProScar generic form, but I have a friend who is the reason I did it because he took it, and I mean, we're talking like within a month. This guy went from, like 75% bald to full, just beautiful flowing mane of hair. And I could see the stark difference between, him and me. And it's just so interesting how it affects men so differently.
Yeah. So there's a couple of ways to figure out if you're going to be getting a response to finasteride. Sometimes it's just a matter of looking at your scalp and doing some measurements. When we have a bunch of different ways to kind of look at the scalp today that we didn't have years ago, we have microscopes and AI software, machine learning software, so we can actually tag each hair without trimming the hair, so we get some good readouts in terms of what the quality of hair is in the good zones that are immune to male pattern hair loss, right? So those hairs around the sides and the back are immune to male pattern hair loss, and how much miniaturization is actually occurring in each area. Because think of it like if the follicles are too far degraded, they're too far dead and gone, they're beyond the point of no return, then the finasteride is really too late in that zone. And it's really going to work much farther back. So if you've lost most of the hair in the front of your scalp, then you're not really going to notice much difference with finasteride unless you're measuring or observing the back of your scalp.
Interesting.
And then there's also now genetic testing, like the tricho test, for example, which is something that can help us determine if you're more susceptible to increasing DHT from the other type of 5-alpha reductase, the type 1 5-alpha reductase. So a few patients that we come across actually make a lot more DHT, or make some more DHT than what would be normal through the type 1 5-alpha reductase. And so that means they would be better off taking dutasteride, which is a little bit of a stronger medication than finasteride.
Oh, wow. So so
we can do that by genetic testing.
Yeah, that's incredibly useful. And just a testament to how far the industry has come, because it's not just as simple as saying finasteride is going to work for you because it works for this guy. I mean, we're talking about genetic SNPs and enzymes and things like this that absolutely affect it. Yeah.
Absolutely. Absolutely. And then the other thing is that if you have a very aggressive hair loss process, then you might need multi-therapy. Most patients today honestly do need multi-therapy. These treatments are synergistic. So not just the oral medication finasteride, but maybe a topical minoxidil or an oral minoxidil could go very far with it. Or we could use phototherapy. If you don't want to use chemical treatments, you can use low-level laser light, red light therapy, or regenerative techniques like platelet-rich plasma, things like that.
And just the last thing about finasteride, is there any impact of using that like on the prostate or any of these more sensitive, male specific parts?
Well, you mentioned that you were taking a generic version of Proscar, and finasteride was really an FDA-approved drug for benign prostatic hypertrophy or an enlarged prostate. So there's millions and millions of men out there around the world who have taken the 5 milligram dose to treat their big prostates. The prostate does shrink a bit when you're on finasteride, and so for most, that's kind of a good thing.
That's good. Yeah, because I know there's a foundation, I think, called the Finasteride Foundation or whatever, and they send emails out and they talk about these things, prostate health. But like you said, I do know that it was about the finasteride was originally for the prostate in much higher doses than you take for hair. So I didn't know if there was any side effects for the prostate, anything guys should know about, in that realm, because of course that's a major issue for men as they get older.
Sure. Well, DHT is responsible for the activity of stuff going on in the prostate, the production of the ejaculate, and the non-sperm component. And when you take finasteride, you're going to lower the functioning of the prostate. And for most guys, that's actually kind of a good thing overall, because as we get older with time, prostates do enlarge, and that can cause urination issues, things like that, urgency, and so forth. Getting up in the middle of the night, So it actually may be a good thing that we're keeping our prostates a little bit smaller with finasteride.
Wow. Okay. So how about red light? You mentioned, shining red light. Is that a red light specific laser, or like, let's say you have a red light panel or red light bulbs and you just shine it on your bald spot or on your head or where it's like, is that something that works, or what is the story with red light and hair loss?
Well, red light and low-level laser therapy is absolutely an effective treatment. We know now here, 20 years later, we have all the science to show and the results to know that it works. But here's the thing. Red light therapy is not going to bring back a dead follicle. So if the follicle, again, is beyond repair, all the same rules apply. So where you're going to get the best results with red light therapy is where you have this beginning part of miniaturization. The follicles are not too far gone. And, a little red light bulb in your closet is not going to do the job. You're going to need to focus that directly on the scalp. We find that laser light therapy works better, and there's probably some good reasons for that. The coherence of the light, the penetration of the coherent wavelengths, maybe even just the scattered part of how the laser affects the skin. But there have been also some good studies with some of these super luminous diodes and how different wavelengths affect the skin. But I think it really comes down to power output. So our newest lasers are going to be like 300 diodes. Those are going to be physician prescribed. I can show you what they look like. Usually medical grade, low level laser light therapy is going to be having a little bit more power output, give you more coverage, give you shorter treatment times than some of the more clunkier plastic units that you're going to see out there on the internet or on cable TV news or things like that,
Right, right. So what are the more, I guess, surgical procedures that you do or you specifically specialize?
Right. So if the follicle's dead and gone and we're not going to employ, something, fruitfully, and let's say to restore frontal hairline, like if we know the medications and so forth are really just going to be for protection, then how do we get that hairline back? How do we restore coverage? Well, we're going to do transplantation. So what is hair transplantation? That entails moving the more permanent follicles, the ones that are resistant to DHT, from the back of the scalp into the thinning or the balding area. So it's a very technical microsurgical process where we can literally pluck or harvest those follicles from the back of the scalp one at a time and implant them in the correct angle, orientation, and position so that eventually when that follicle kicks into gear, it's going to grow the hair in a normal direction, and the hairline, the resulting coverage is going to look 100% natural. So it's a pretty cool technology, totally different than your dad's and granddad's plugs and painful procedures of the days of old. This is a very comfortable procedure, but it does take a long time to execute.
And by long time, do you mean multiple visits, or like the one procedure takes a long time to do?
Well, each hair transplant procedure could be 6 to 8 hours in the chair, theoretically. We often do sometimes back-to-back procedures, meaning that we're doing consecutive days to get more hair, move hair around. But that time you spend in the chair is not painful. It's not like getting a tattoo for 8 hours. You're going to be watching Netflix. We feed you lunch. Hopefully, we don't have to feed you dinner. But the team is catering to you. You can get up and use the restroom. Your scalp is completely numb under local anesthetic. And we use usually a little bit of sedation just to keep you relaxed if you need it.
Yeah. Oh, that sounds like a lovely afternoon, actually.
It's really not too bad. A lot of our, busy professionals actually kind of enjoy just sitting and watching, whether it be the news or they watch sports or the Olympics now. I mean, they're watching whatever they want, or just, watching the underwater fish videos. Not too bad either.
Yeah. Oh man, I could imagine
a couple of hours to get the procedure done.
I could imagine someone in Florida watching the news and just getting so angry while you're trying to have surgery on them. I'm sure that causes a few conflicts.
Yeah, we don't usually let them watch finance or news, but if that's what helps them relax, knowing what's going on, then it's okay.
For sure, we
let them do it.
So this might,
for some, that's relaxing.
I get it. I know the world we live in now. It's pretty wacky. And actually, this is kind of a goofy question, but why is it that, in male pattern baldness, it's this specific area, like the Caesar, that stays and the rest of it goes?
Yeah. So evolutionarily, why does the back of the scalp, the sides and the back of the scalp, why is that area immune to the effects of DHT, dihydrotestosterone? And the cool thing is, obviously, is that when we take those follicles, they retain that property. I mean, that's really the tenet, the cornerstone of hair transplantation, is that when we put it into the other balding area, it wasn't a problem with the soil in that zone. If you think about it in that analogy, it was the problem with the plant. So when we put the follicle into the balding zone, it actually lives and grows permanently there forever, relatively permanently. So I don't know, if you asked my grandmother when she was alive, why is it like that? She would say, so Alan would have a job.
Oh, okay. I got you.
So we don't really know, obviously, why, why do those follicles, why are we made that way? I think a lot of it has to do evolutionarily with a sign of aging. So, why doesn't all of our hair fall out when we age? I don't know, but it's a general sign from the front and from the back, that we're advancing in age. And as we said before, if someone wants to look youthful and feel full of life and vital, sometimes a full head of hair is an important piece of that puzzle. And, for both men and women, it's important, and that's why we have our procedures and treatments available for them.
And I'm wondering, like, if there's, I guess, because we're talking about, hey, evolution, and we're talking about, the genetic SNPs, how they impact your 5-alpha reductase a little differently, which impacts your DHT. I'm curious if there's any connections between the actual pattern that you see in baldness. So like, some people bald from the front, some people bald from the back, some people just lose it all at once. And any other associations within the body, like, high blood pressure and this type of balding, or metabolic disorders and this type of balding.
So I'm not so sure there's any really strong connection with metabolic disorders, but at one point, something came across my desk that there's a correlation between male pattern baldness and cardiovascular disease.
And what are these connections?
Oh, so if you're more prone to cardiovascular disease if you have a severe degree of balding.
Wow, that's crazy.
Yeah. And more recently with COVID-19, there's actually the Gabrin sign, which is something that they discovered in Europe, that guys who were in the hospital wards on ventilators, they were more likely to have a balding pattern that was significant. And so they think that has to do with the temperus, which is the expression of the androgen sensitivity, and the androgen receptor is very, very close to the ACE2 receptor on the type 2 pneumocytes. So basically, if you are prone to male pattern hair loss, you may have an increased androgen receptor sensitivity, and that may make you more susceptible to COVID-19.
Oh man, that is wild.
Yeah. So there's a lot of interesting research going on, still going on today about that. The Gabrin sign is literally the name of the physician. It was named after the physician that noticed this in the wards. I think it was in Spain or France. I can't remember at this moment. And actually, he eventually died of COVID. But the Gabrin sign is well known in the sphere of hair loss and hair restoration physicians now. And a lot of interesting research, maybe that patients who are on androgen blocking or androgen reducing medications, whether it be for prostate cancer or for male pattern hair loss, may actually fare better in the realm of COVID-19. Wow,
that's such a wild focus of research, because we don't know much about COVID. Like, we're still learning stuff, and I think any association is certainly welcome to be explored, and that would definitely make sense.
Oh yeah, so that's some interesting stuff, and I don't know if you have show notes, but if you like to highlight some of that research, I can send some of that stuff over to you. It's pretty interesting to read and see, how the expression of that androgen receptor may make you more susceptible to COVID infection.
Yeah. Please send that over, because once we release this, we'll have show notes, and people love clicking on the links and going and checking out these different research. We have a lot of nerds in this audience, so they get into that stuff.
Yeah, for sure.
Yeah.
Well, the biohackers are all of us are like that,
Yeah.
We want to deep dive into everything for sure.
We got PubMed on our phones, and we send our poop in the mail. We are a wild bunch.
Exactly right. Tracking our sleep and wearing CGMs.
Yep. So, you were talking about some holistic things, some kind of more health and wellness based stuff that kind of goes along with, preserving hair. So could you maybe go through some of that?
Yeah, absolutely. So we take a very holistic approach. I always like to find out from the patient, obviously, especially in these days, if they're dealing with a lot of stress, and if their nutritional status is up to par, or if their sleep-wake cycles have been disrupted, because we know all of those things can have an impact on their hair. Whether it's a male or female patient, we definitely want to get a handle on that. So how do we intervene? Well, a lot of my patients are biohackers. So we do end up talking about tracking sleep and nutritionals and bed chillers and you name it when it comes to getting good sleep, which I think is the Swiss Army knife of wellness. And the biologic clock internally in the brain, the circadian rhythm, definitely has an effect on those cyclical organs, especially our hair follicles, which tend to turn on and turn off on a regular basis, through these phases. That's what the normal shedding is, right? So out of 100,000 hair follicles you have on your scalp, about 85% of them are in the growing phase right now. The rest of them are either in degeneration, resting, or regeneration. And through that cycle, you can have shedding. And this becomes more important if you have very long hair. Maybe in females, they tend to see these ebb and flow of shedding phases, especially if they're under undue stress or if there's some nutritional imbalance or sleep-wake cycle disruption, sleep arrhythmia. You can get basically an arrhythmia of the hair follicle causing more shedding and so forth. So what do we do about it? Things like minoxidil, as I mentioned before, that's a topical medication or could be an oral medication to turn the follicle on and keep it on in the growing phase, very popular. But on the holistic side, we want something like a stress adaptogen, a nutraceutical, for example. Like I'm a big fan of Nutrafol, and we have our own nutraceuticals in the Bauman hair wellness system that can help reduce the effects of stress, make your follicles really more resilient to those effects as well. So ingredients like ashwagandha, decreasing inflammation with curcumin, turmeric, saw palmetto, if you don't want to use finasteride, can help block or lower the DHT levels, and different antioxidants obviously also can be important as well.
Saw palmetto is one of those that for a long time, that's like the go-to, it was the go-to supplement or the go-to herb for specifically hair loss. Sure. But I feel like over the years, I've heard there's some drawbacks to saw palmetto or some side effects that come with it. Have you heard anything like that, or have you seen anybody doing that and it's actually, made their situation with hair worse?
I've never seen anybody get worse on saw palmetto. I mean, it's really, an organic anti-androgen. It's included in a lot of our nutritional products. We use saw palmetto in our hair care products and shampoos and conditioners and so forth, as well as the nutritionals, as I mentioned. I've never seen a side effect from saw palmetto, but some patients, if you're out there on the internet, they do seem to be sensitive to that. So it's almost like if you give them a whiff of an anti-androgen, then all of a sudden, there's this side effect profile that kind of pops up, similar to what you would see with finasteride. But it's very, very unusual. Again, I haven't seen it in my practice, but, there are reports of those things out there on the internet.
Yeah, of course. It all comes down to bioindividuality. Everybody's different. I mean, you would probably be shocked at some of the things that, people are sensitive to. And certainly that definitely makes sense. With the stress component, I'm curious if there's any specific research that ties like stress hormones, cortisol, norepinephrine, that sort of thing, to directly affecting hair follicle health. Have you seen anything like that? Or?
Oh, absolutely. So inflammation and the effects of cortisol and stress are very well documented in the peer-reviewed clinical literature. I mean, basically, if you want to shut down a hair follicle in a petri dish, you put cortisol there. Boom. I mean, that thing just shuts right down. And there's almost like an HPA axis in each hair follicle in and of itself. It has all of those components of the typical axis that we see, in the brain and the body. And cortisol will definitely shut down the hair follicle. And so it's not just an old wives' tale, like when someone was under stress that, they have a shedding phase. We see it. Physiologic stress, perceived stress, and actual mental stress, all of the above can definitely shut down some hair follicles. So, stress reduction, stress management. We have treatments actually in the office that we do to keep the scalp healthy. And those happen to be very relaxing. So those are some of the do good, feel good therapies that we actually perform in the practice. Those are non-invasive. They feel great. A scalp massage for 90 minutes is, basically it's like a trip to Neverland and back.
Yeah.
But those are designed specifically for the patient's conditions, typically. But many patients just come in repeatedly for that therapy over and over and over again, especially during the pandemic, as kind of like a little getaway just as if they were going to schedule a relaxing meditative session or massage session or a yoga a yoga session, whatever. This is like, a scalp therapy. We call it the scalp makeover. And, that's a very, very relaxing therapy. They'll get a little bit of laser treatment in the office. They can have different types of herbals and essential oils applied, depending on their current scalp condition. Obviously, if they're aiming to try to decrease shedding or to, mitigate male or female pattern hair loss, or if they have some kind of inflammation on the scalp.
And I wonder if there's any connection, when we're talking about genetics and we're talking about, this familial balding from, one generation to the next generation. I wonder, because they've been finding these transgenerational responses to cortisol, how, like if a mother is feeling so much cortisol, she can pass that down to her child, who they can feel that, I believe, even 2 generations down. So like if you might have a family member who survived the Holocaust or something, let's say, or was in World War II or whatever it is, you might now, as that second generation, still be feeling your grandparents' stress, which of course they were bald, your father or mother was bald, and now you might be experiencing that stress leading to baldness. Just something I was thinking about.
These epigenetic factors are so important. I mean, it's just like you would inherit the sensitivity to DHT, obviously, and then it can be affected by other things. Like if you're a smoker, obviously, that's going to have some kind of effect on the follicle as the circulation gets shut down in those areas of the skin. But yeah, if you're a particularly sensitive person to stress or poor sleep and all that, sometimes, as you say, these things get passed along, as we know, generationally.
And are you, for women who deal with this, I don't know how much you treat women, but what typically, stress, of course, probably lack of sleep, but is there anything specific you see with women or any patterns you see with women that leads to, and to say like, I know women might not necessarily have a bald spot, but it seems that women are constantly, like, the hair is constantly falling out. I know, because I live with one, and there's just hair all over the place. And so, I'm wondering if there are any patterns that kind of go along with that.
Yeah. So my practice is kind of unusual. About 50% of our patients through the door are women, and their hair follicles are typically a lot more sensitive to a lot of these things, maybe than even the male patients are. So again, we look at hormone levels. We can do blood tests. If there's issues with hair extension use, types of hairstyling habits, exposure to chemicals and heat can definitely shut down the follicles. And so that's more common in women than men. Hormonal changes. If you look at the chart of hormones in men, it goes like this. Boop, it goes, just goes down. And then hormone changes in women, it looks like an EKG. It's like all the way through. So those hormonal changes can really impact hair follicle function. And of course, around menopause and childbirth and, other interventions that happen during the course of their lives, that can trigger these shedding phases and then also reveal an underlying tendency towards female pattern hair loss.
Yeah.
So there's a lot more digging to do. There's a lot more investigation when a woman comes in and says, "Hey, you know what? Over the past year, I've seen a lot more shedding. My ponytail volume is less. I think my hairline is weakening. I'm seeing breakage. My hair is just it's not taking color the same way. It's, there's different things that are happening. It just looks more dull. It's not as shiny. It just looks limp. It's lost its life. It's lost its volume." That's what I hear a lot. And so we have to do a lot of digging on that one. Looking at, what changes are happening metabolically, what are their hormone levels, including thyroid and cortisol, and those sleep-wake cycles, their nutritional status. Did they just lose weight? Did they just have a baby recently? Did they just have surgery? Did they just go under general anesthesia? These are all major. Or did they just get put on statins, antidepressants, blood pressure medication, mood modulators? Those are all very, very common triggers for hair loss.
Yeah. And I feel, now that you're mentioning that, I feel like when I see these commercials for different medications, hair loss is always one of those side effects.
Yeah. Well, as I said, the hair follicle is a very highly metabolic cell population in your body. Honestly, that's why, if you get, God forbid, need chemotherapy, what are you trying to shut down? Well, you're trying to shut down the cancer cells, which are rapidly dividing out of control, but it also knocks out your gut, your bone marrow, and your hair. Those are like the top 3 highly metabolic cell populations in your body. And so it just kind of makes sense that things that interrupt your nutritional status are going to be more visible in the hair pretty quickly. It's a very strong barometer of your health.
Yeah. And now that,
and then what about all the crazy diets? I mean, keto and, fasting and down here in Florida, we had the cookie diet for a while. I mean, all kinds of crazy stuff. So rapid weight loss changes your metabolism in a way that could affect your hair too.
Yeah. And while we're on the topic of diet and that sort of thing, do you know of any research out there that ties like microbiome health specifically to hair loss?
Absolutely. So we are super keen on the gut, brain, skin axis. We know that the microbiome regulates a lot of these different wellness functions in the body, not just making you more resilient to stress, but reducing inflammation, handling your emotional stability, and everything from allergies to digestion to sleep to glucose processing, you name it. Microbiome is a huge portion of that. Which is, circling back to why you sending poop away in in a box in the mail. Obviously these are some of the things that we're very, very keen on. And so there's actually been identified some strains of lactobacillus, which are very, very closely tied to improved hair growth or good hair growth. So for example, like when patients in my practice undergo hair transplantation, they often are treated with an antibiotic, obviously during the procedure time. So just a couple of days. And when we give the antibiotic, we also give a probiotic with it. And the one that we give is a very, very strong one. There's a few different ones, but Nutrafol has a probiotic called Hair Biotic. And we have another one that we found works also good as well under the Bauman brand, Bauman MD. It's called the Good Guys. And that really, really improves the microbiome health, I think, if you're on that probiotic. You're going to absorb all your other nutrients better. If you're taking collagen daily, things like that, things are just going to work a lot better if your gut microbiome is, optimized.
Do you see any connections?
Yeah, there's a lot of information on that.
Yeah, that's so interesting. And do you see any connections between, because you're saying the skin biome with the microbiome, with something like dry skin or flaky skin or even eczema with hair loss?
So the research that we're familiar with is that there now is a huge connection between inflammation at the level of the scalp and impaired hair growth. And so, probably the most obvious versions of that are some of the scarring types of alopecia, which, the inflammation is literally visible to the naked eye. You can see the redness, you can see the inflammation around the base of the hair shaft, which is called perifollicular and infiltrates and inflammation. You can see the skin kind of tenting up as the hair is growing out of the scalp. You can even see scaling, or it could be itchy. There could be other signs and symptoms there. And so we take care of a lot of that. Seborrheic dermatitis is very, very common. So an overproduction of sebum level at the level of the scalp, and the exfoliation of the skin cells forms a feeding ground for an overgrowth of microorganisms like yeast and fungus and things like that. And so making sure we're getting a handle on that. People are using, like, for example, conditioners as shampoos. They're not using as much shampoo these days, or they're shampooing less frequently. They've been told they should not shampoo so often. And sometimes that has a detrimental effect on the microbiome of the scalp and can cause a huge outbreak of seborrheic dermatitis and all this inflammation and really poor quality hair growth. So that's kind of where the scalp makeover comes in. We can take a look at the scalp using a pH meter, moisture level, sebum level, and apply even a Ceravive treatment, which is basically like it's a hydrofacial for the scalp that clears out all that debris and sebum and skin cells, and really cleanses the scalp and provides an optimum environment for healthy hair growth. I mean, you got to have good soil to grow a good plant, right?
Totally. That's so true. And speaking of shampoo, are there any shampoos that somebody should avoid, or any shampoos that you think are particularly good? And it's so interesting you mentioned conditioner, because I don't use conditioner. I haven't for a while, but it is a commonly used product. So I don't know if there's good shampoo and bad conditioner, bad shampoo, good conditioner. I've heard different things about, things like Head and Shoulders. What is your take on shampoo, conditioner, hair products?
So that could be a whole podcast in and of itself.
Sure, I get it.
So but here's the kind of Cliff Notes version of that, or Spark Notes if you're from that generation. The bottom line is that what's right for you is going to be different than what's right for someone else. And also your correct frequency and product use is going to change as you age. So think of it like skincare, right? Your skin changes when you're a teenager. It's very oily. Maybe even you could have acne, and then it gets a little bit drier as things go along. And so you want to change your skincare regimen. You're going to have more exposure to insults and injuries and oxidation and UV light and so forth. And so you need to protect your skin in different ways as you go through life. And so scalp is the same. So it's not an easy answer. There are bad ingredients, there are ingredients you should try to stay away from, like sulfates and phthalates and parabens and things like that. And there's a whole laundry list of things that are associated with not so good stuff on the scalp. And if you're allergic or sensitive to certain fragrances or ingredients, you got to be aware of that and stay away from some of those things, so that you can keep your scalp healthy and not inflamed and keep everything kind of cool. But that's where trichologist comes into play. I have a full-time certified trichologist and licensed cosmetologist in my practice, and her only job in her department with her assistant is to keep the scalps healthy. So if you've got some kind of scalp sensation, itchy, oily, flaky, greasy, you name it, I'm going to send you to the trichologist, and we're going to figure out what to do together. She's going to do that complete evaluation and figure out what are the right interventions, and then habits for scalp hygiene are going to be correct for you. Now, in my practice, I also prescribe a lot of therapeutic shampoo ingredients. So, for example, the Bauman MD line of shampoo has saw palmetto, caffeine, green tea, and these are all things that can have an effect on the DHT affected hair or hereditary hair loss. But it's not a one size fits all. I mean, it's a one size fits most, but there's nuance to that as well.
Absolutely. Yeah. And it's so funny you mentioned caffeine, because, my wife, she reads the mommy blogs and follows some people, and they'll be like, hey, my latest make it at home shampoo. And it's like coffee grinds and honey and lemon and all this stuff. And we just have bottles of hair care products that just were taken straight out of the fridge. So it's funny that you mentioned those specific ingredients.
That's awesome. Super holistic, DIY shampoos. But, that's all good. I mean, a lot of people want to do that, but don't really have the time. So that's why we try to curate that stuff for them.
Totally. Yeah.
Yeah.
Yeah. It's just so interesting to know, like, you don't have to be a slave to like your local grocery stores, line of shampoos. Like, there are interesting things to experiment with. And like you said, it's all individual. So you never know what can happen.
Absolutely. Well, the reason why you walk down a grocery store aisle and there's thousands of bottles of shampoo is because there's not one size fits all. And, even just the level of conditioning, for example, is going to be totally different for someone who has coarse, curly, kinky, Afro textured hair versus someone who has thin, straight, finer, wispier hair. I mean, that's a totally different, there's a huge difference between the conditioning spectrum on those two patients potentially. And we have to be cognizant of that.
And how about like hair coloring, or, when I was younger, I used to bleach my hair a lot. Is there anything to, people who use those sorts of products on their hair to increase hair loss or anything down that road?
Well, the reason why people choose to color their hair generally is because they don't like the gray, right? So that's, that would be the most common reason. They don't want to appear older than their age, or they don't want to be prematurely gray, or they don't want to be gray, end of story, period. Now, that having been said, so people are going to color their hair no matter what. But as we mentioned before, chemicals and heat and these types of processing can put your hair fiber at risk. So if you have a thin, weak, wispy hair, think of it like an old t-shirt that you leave out in the sun for too long. That t-shirt's going to get destroyed after a week or two in the summer heat, from the UV exposure. And the hair doesn't self-repair. No matter what these shampoo companies try to tell you, you can't repair a hair shaft that's been damaged in its cuticle. You can kind of fill it in a little bit with some chemicals and things like that, but you need to grow good hair from the get-go. So that's where different types of therapies like red light therapy, good nutrition, keeping your inflammation levels low, platelet-rich plasma injections, things like that can be super helpful in growing good hair if you're going to plan on mistreating it, meaning that you're either going to blow dry it straight with a lot of heat or use a Brazilian blowout type of process, or you're going to color it, dark, light, or whatever. The more you process that hair strand, the more it's going to degrade the cuticle. And then you've broken the moisture barrier. And the more that happens, the more the hair fiber itself is prone to breakage and split ends and looking dull and not feeling smooth. So those are all, issues that can affect the aesthetic qualities of hair. The hair loses its aesthetic value when it's dull and not shiny and it's broken or damaged.
That's a great analogy. Yeah, the t-shirt outside and just the treatment of hair over time, like it could be a practice that you implement from a young age, especially for guys. This is so important, if you're at risk of losing your hair, to do the things you mentioned, especially, and I say this in every podcast, but keeping inflammation low, keeping stress low, implementing red light, all that. I mean, that's really good stuff. Dr. Bauman.
Early intervention is really the key to the whole thing, to be honest. I mean, in summary, we know that you could lose 50% of your hair without it being noticeable to the naked eye. That means you have the same amount of coverage with half of your hair than you were born with. But the coverage looks the same, but you've lost half of it. So how do you know? Well, you have to have an evaluation. You have to have a metric, and you have to measure the hair and know what's going on. You might be seeing the little signs of a receding hairline like I have right here, but did you know that I'm 30 to 40% depleted right up in this area? I mean, that's why I fight like hell every day to keep my hair, because I know that even though it doesn't look bald or bare or even thin to the naked eye, I know how much I've lost already.
Yeah. And this is the struggle. This is my struggle as well, my friend. This is just use what you got, use it the best you can. And if nothing else, there's always the comb over.
Oh, man. Or the baseball hat? No. We're going to restore your hair. You're going to have to come and pay us a visit in Florida.
Okay. One last question, since you just went down there. Wait a minute. Is there any truth to this myth, this old wives' tale about wearing baseball caps and it increasing your chances of going bald?
So there's no way that a baseball cap is going to trigger hair loss or cause hair loss to occur. But for sure, if you're wearing a baseball cap, two things are happening. Number one, you're going to have hat head when you take it off. So your hairstyle is going to be no bueno. Okay. And the other thing is that if you're wearing a hat, it does reframe your face. So it does make you look more youthful when your hair, when the brim of your hat is down here, it reframes your face like you used to see when you had hair there. So it makes you look good. But unfortunately, it delays your treatment. So over time, your hair loss will get worse. 75% of the time, your hair loss will be much worse in 5 years. So that's no good either. That's also no bueno. So we've got to try to hold on to the hair that we have. If you're starting to see some loss, realize that it's not going to just stop. You can't deny it. It's going to continue over time, and you need to fight the fight if you want to just even keep what you have.
Yeah. When I was young, I swear I heard that so much, that if you wear a hat, my old Jewish mother, if you wear a hat, it's going to make you go bald, Eric. You don't want to wear the hat too much. You're going to go bald. You look like your father. I get it.
Oh my God.
But it's good to know.
That's hilarious.
If nothing else, we just completely busted that myth, and we can put that one to rest.
Yeah. So it is Hair Loss Awareness Month. I don't know when you're releasing the podcast, but we're in Hair Loss Awareness Month. So it's important to do that myth busting. That's a very common one.
Hair loss awareness.
And also that it comes from your mother's father's side. We know that that's not the case. We talked about genetics before. It can come from mom's side or dad's side.
Oh, that's another big one. Yeah, I'm so glad you brought that up, man. I know we got to close up shop here, and I feel like we're just getting into the meat and potatoes of everything. But Dr. Bauman, I certainly appreciate your time. This has been such a fun conversation, such an interesting conversation. For people who want to work with you, who want to know more about you, I don't know if you put out content discussing these topics for people. Is there any social media? Please let the viewer know where to find more about you.
Absolutely. So you can find me on all the social media platforms at Dr. Alan Bauman. But if you would like to get started on your hair restoration journey, it all starts with a conversation with me. And that's a consultation that can be done virtually. on a video call or through an in-person visit. And that can be initiated at baumanmedical.com, BAUMAN medical.com.
Awesome. And when we release this, we'll put all those links to everything so people can easily find you. And definitely, Dr. Bauman's one of the best guys and ladies. So if you are noticing a little stuff coming off the top, definitely look up Dr. Alan Bauman, and I have a feeling you won't be sorry.
Thank you so much, Eric. Listen, this has been great. I know we just scratched the surface. There's so much more to talk about. But again, if anybody's out there with a hair loss concern, we're here to help. We can talk about it.
That's great. And thank you, listener, for watching. I hope you enjoyed the podcast. If you did, remember to subscribe to the YouTube channel, leave a review on Apple iTunes. And for more, check out Dr. Bauman and all his information. And for more on us, go on over to holisticnootropics.com. Otherwise, we'll catch you on the next episode. Peace.
Thanks for listening. For more brain-boosting info, in-depth articles, and show notes, check out holisticnootropics.com.